Hello, everyone, and thank you for joining our book talk about Dr. John Gottman and Dr. Julie Gottman's latest from W.W. Norton, The New Marriage Clinic, a scientifically based marital therapy updated. My name is Kevin Olson, and I'm the Associate Director for Norton Mental Health. I'm thrilled to be introducing the Gottmans and our moderator today, Laura Heck. The New Marriage Clinic is the first update in 25 years of Dr. John Gottman's classic, The Marriage Clinic book. And Laura will be talking to the Gottmans about the exciting new interventions and key takeaways for clinicians featured in the updated edition. As many of you know, the Gottmans are world-renowned therapists, marriage and family therapist experts, therapists, conference speakers, and co-founders of both the Gottman Institute and Effective Software Incorporated. They were recently honored with a Lifetime Achievement Award by Psychotherapy Networker, and they're also the authors of multiple best-selling MFT books from W.W. Norton, including 10 Principles for Doing Effective Couples Therapy Work, The Science of Trust, The Science of Couples and Family Therapy, and the Marriage Clinic Casebook. Moderator Laura Heck, LMFT, is a certified Gottman therapist, co-host of Marriage Therapy Radio, training specialist for the Gottman 7 Principles program, and co-author of Reconnect, a marriage counseling workbook available from Random House in September. Please leave your questions in the chat, and we'll try to get to as many as we can after Laura's conversation with the Gottmans. And we're also featuring 20% off and free shipping, not only on the New Marriage Clinic, but all of John and Julie's books from W.W. Norton. So we'll be sharing those direct links in the chat if you'd like to get more clinical resources from the Gottmans. And without further ado, I give you Drs. John and Julie Gottman in conversation with Laura Heck about the New Marriage Clinic.
Thank you, Kevin. Thank you, Dr. John Gottman, Dr. Julie Schwartz Gottman, for joining us. I'm really excited. This has been just an honor to go through this book. This is not the second, but the third time that I've actually read this text. This was an original text that, as I was going through my clinical studies to become an MFT, this was required reading, and this was one of the many required readings actually that was authored by either of you, both of you. So this was a pleasure to go through. I'm really interested. I'm curious, really, what prompted you to update the marriage clinic? I'm wondering what brought that about. It's been 25 years since the original edition.
We're 25 years older and wiser. That's part of it. But also, we have made huge strides in intervention with couples in the last 25 years. We've created lots of new interventions, and we've also created a platform, a software platform on which clinicians can do assessment with barely lifting a finger to just click a key, and getting recommendations as well as descriptions of 37 interventions, I believe. Right, sweetie? That include little videotapes and so on. So we wanted to just really, with excitement, share all the progress that's been made.
Yeah, and let me add, Laura, that in 1999, when the Marriage Clinic book was published, all the findings were correlational. We knew the difference between the masters and the disasters of relationships, both for same-sex couples and cross-sex couples. But in the last 25 years, we've really been able to make those relationships causal by doing randomized clinical trials, testing the effectiveness of these interventions, and also prevention as well as intervention. So all of that is new.
Yeah, you've had quite an evolution. You had mentioned a couple of things, and I do want to touch on that. I want to talk about the platform, not yet, but you did mention the addition of some new interventions. And I have my favorites. I have been dying to know what your favorites are. If you find that, regardless of the couple that comes into your office, because obviously there's interventions that you may not even use with a specific couple. Of the interventions that may be new to folks as they're going through this book, I'm wondering, what is one of your favorites and why? Why is it so important to be able to use it? And if you could explain a little bit about one of those interventions.
Great question, Laura.
Thanks.
So I think probably of the newer interventions, my favorite is called the aftermath of a regrettable incident. And what we have seen, and here is where some attachment work comes in handy, but just emotion focused. And that is that when couples have a horrible fight, or turning away when they should have been turning toward, some really big incident that causes some kind of emotional injury in the relationship. It's
Mhm.
so very important to help couples to process their own perceptions of what happened during that incident, and eventually to take responsibility for it. So we created a 5-step process, which really gives guidelines and guardrails for couples to really understand each other's points of view about what happened, and also what may have gotten triggered for couples, because as you all know, audience, couples often carry a lot of baggage into their relationship, and that
Mhm.
baggage, right,
Mhm.
can
Yeah.
really get unearthed by, a little button being pushed in a regrettable incident. And so we have couples talk about how they got triggered during this process as well. And the point of it is not to solve a conflict. The point of it is to understand how the communication went wrong and how to make the communication better next time.
Wow.
I
Okay.
think I think one big thing that was missing in the original marriage clinic was any mention of sex. And now, very critical research has been done on what's the difference between couples who say they have a great sex life and couples who say they have a terrible sex life. So Julie and I created this series of 7 interventions that we called Got Sex, after the Got Milk ads.
We didn't think of it.
I know,
Yeah. Yeah.
but we really have a systematic approach to improving a couple's sexual relationship that really seems to work well, and I
Yeah.
think that's an important thing that was missing from the marriage clinic in 1990.
Yeah. Yeah, absolutely. And I was just thinking too, if of one of my favorite interventions. So Julie, you had mentioned, you're kind of systematically going through, it's like a blueprint. And I'm thinking of all the other interventions, some of the newer ones that are included that also act almost like a blueprint to give to couples as a guide to systematically move them through a process that might feel less organic to them, but it's a new skill.
Mhm.
One of my other ones is the Dreams Within Conflict blueprint that's out there. Can you explain a little bit about the Dreams Within Conflict intervention that's in this new book?
Oh, absolutely.
Okay.
That is one of our favorites. And
Okay.
let me just say something, Laura. The Dream Within Conflict originated in about 5-year long gridlock conflict between John and me, where we had gone into we'd gone into couple therapy, and this is long before we created our own theory and our own stuff, our
Oh,
own
I love that.
interventions.
This is
Isn't that great?
insider info. Yes.
I know. Oh my God. And so this therapist loved John. He was charming and intellectual. She didn't like me very much. So, as a consequence, at one point, she said to John, John, you can just say no to Julie. It's okay. You can just say no, and that's it.
She was all about creating boundaries. A
Yeah.
healthy
Okay.
relationship has to have boundaries. That was the
Mm-hmm.
concept of individuation that came from
Uh-huh.
Mary Bowen.
Yeah, that's
Yeah.
right. So she was a real Bohemian. So John and I left the office after that session, and he turned to me and he said, "Honey, do I sound like that?" And I said, "Well, yeah." And he said, "Oh, no, that's not the husband who I want to be."
Wow.
So we fired the therapist. Yay. I was
Yay.
really happy. And we went home and we just started asking each other these huge questions to really understand each other's position on this
Yeah.
issue.
Mm.
And the thing that was amazing is what came out. What came out of those questions, much deeper understanding. And then we went back to the videotapes and we saw that the really successful couples were doing exactly the same
What
thing.
we were doing, yeah.
Right?
That's right.
Yeah.
Wow.
So in the Dream Within conflict, what's happening is that in the midst of either a perpetual or a gridlock conflict, one person becomes the listener, the other the speaker, and the listener is asking the speaker much deeper questions to understand really what the position that speaker is taking is all about. So the questions include things like, do you have any beliefs, ethics, or values that are part of your position on this issue? Or is there some background history or childhood history that's part of your position on this issue? So there are 6 fundamental questions that a listener will ask the speaker, and the listener doesn't bring up their own point of view until it's their turn to be the speaker. So people reverse roles after one person answers all the questions. So both people get a chance without interruption to really go deep into what is beneath, what is subterranean in their position on an issue. And what happens as a result of that is that people's connection really grows, their understanding grows, their compassion grows, and they have a much deeper appreciation for the position their partner has taken and their partner themselves. So compromise, which may follow that, is so much easier because people have been softened. That space between them has really been softened and rendered much more visible.
Yeah. Yeah. I absolutely understand what you're talking about with this. And it's interesting because oftentimes at the end of a Dreams Within conflict, the couples don't even feel like they have a problem to solve any longer. It's just that sense of connection. If they were looking for connection, which I think ultimately is underneath a lot of it, not necessarily solving the problem, but just wanting to feel reconnected. That is 100% that softening that happens between the two of them when they develop more empathy and compassion for the other point of view. Again, one of my favorite interventions, absolutely, that's in this book. Okay. Well, I am curious, kind of on a broader point of view with the new marriage clinic, what are some of the key takeaways for clinicians who are interested in purchasing this book about learning about Gottman method? Something in particular that you're wanting to pass on to folks, because I know there's a lot in this book.
Yeah, I want to say one thing about it, which is that in our approach to couples therapy, the therapist is important, but there's an added step. We want really the couple to learn how to do these things. We want them to change in the therapy. So what we do very often is really, after something is done, like some insight is arrived at, we ask them to state all of this in their own words to one another. So the focus is very much dyadic on whatever the therapist is bringing out. We want those skills to eventually reside in the couple, so the relationship is changed, rather than just assuming if the therapist has modeled empathy and compassion, they're automatically going to do that, because I don't think they will.
Yeah, that kind of renders our job obsolete after a while. We're working
Right.
ourselves out of a job, right? By
Exactly.
teaching the tools to the couples.
Yeah.
Yeah.
Right. Right.
Okay. Would you say that this book is more specifically geared toward clinicians or toward students who are in the field, as opposed to many of the books that you have written that are more geared toward the layperson or the couple that might be struggling?
Mm-hmm.
Yeah,
Okay.
I would definitely say so, Laura, because it's really describing in detail the actual interventions themselves, the assessment methods, which again, can all be done via a software
Hmm.
platform now.
Yeah.
And it just really gives the clinician very clear guidelines and knowledge about
Mm.
what to do when you're encountering a particular kind of couple, as
Yeah.
well as general information that can be used for anybody that walks through your doors.
Yeah.
Yeah.
So even in the old marriage clinic, assessment was very central. Before
Mm.
intervening that idea, first you assess the relationship and find out what other comorbidities exist, like domestic violence. Is there an affair? Uh, is there depression? Is there addiction? What's going on? What's the background history, childhood history of the couple? But now we've streamlined all of that because with Gottman Connect, that assessment becomes automatic. The therapist no longer has to score questionnaires. You know, the computer does that. And
Yeah.
they automatically get a report that is very specific about what are the strengths in this relationship, what are the areas that really are challenging, and
Mm.
then they're directed to specific interventions. So the
Yeah.
therapist's job becomes much more streamlined and easier so they can really focus on the couple and not
Hmm.
on the details of filling out questionnaires and scoring them and doing all that legwork. The computer's doing that. And
Yeah.
then, in addition to that, in Gottman Connect, there are these 37 video modules that the couple can have on their phone. And the therapist can assign the couple to at home to look at these videos, how to do it wrong, how to do it right. You know, if they're doing turning toward or love maps or fondness and admiration or working on the sexual relationship or working on conflict. So they have this resource handy right in their phone. And it just
Hmm.
really streamlines therapy, I think.
And
Yeah, I was
well, I was
just
going to ask it. Go ahead, Julie, please.
Well, I was just going to say the other thing is that, we have described in text how to do all of these interventions that we've created, which is
Mm.
really exciting. And we've tried to be as clear as possible about how to do that. And I don't know about you or your audience, or our audience rather,
Hmm.
um, but it really helps me to see somebody doing it. How do you do it? And so John and I had such a great time making these little videos, the 37 videos he's talking about on Gottman Connect, um, where, you receive recommendations from the assessment, and then you can go to, as a clinician, you can go to any of those interventions and
Hmm.
get a visual video of John and I doing it the wrong way, as well as doing it the right way, which is so much fun because John and I have had so much practice doing it the wrong way that those films are like very precise. So we had
Yeah, we
we had a
learned
great
we
time.
learned that any intervention can be sabotaged
Yeah.
by the couple if they really want to. So it's
Yeah.
helpful to point out how to sabotage these interventions and how to avoid sabotaging them, how to
Yeah.
make them really effective.
Yeah.
And a sense of humor goes a long way.
The other thing that I really love about Marriage Clinic 2, the second Marriage Clinic, is that we have incorporated into it many more stories, a lot more
Mm.
stories. I mean, the first Marriage Clinic was, pretty descriptive, research based. And we have the research in here as well, and including
Hmm.
all the new stuff we've done.
Right.
Um, However, we've also brought in a few cases of our own experiences in the office, what it feels like within your body as a therapist,
Yes.
to be
Yeah.
sitting there with maybe somebody in a couple who's flooded, etc. So, we have tried to make this a more enjoyable read, a more storytelling read for
Yeah.
people, as well as descriptive of the methods and assessments themselves.
Yeah.
Yeah, I want to add one other thing that is really different about this, which is that in the original marriage clinic, trust and commitment were not there in the theory. It were just the
That's right.
7 levels. And, we realized the limitations of the original theory and found the ways in which it was wrong. And fundamentally, trust and commitment have to be the weight-bearing walls of the sound
Mm.
relationship house. And that really involved a lot of new research and a lot of testing. How do you rebuild trust? How do you
Mm-hmm.
a lot of times you see couples and they have a house together, children together, but there's no commitment. They're
Mm.
really always thinking I can do better after a fight. And so
Yeah.
Carol Rustbolt's research comes in, Shirley Glass's work, and now our very effective program for treating affair couples is
Mm.
part of the new marriage clinic, as is
Yeah.
our treatment of situational domestic violence and gay and lesbian couples and how different they are and how the therapy really needs to be changed for gay and lesbian couples. All of
There's
that's
a lot, absolutely. You mentioned a fair recovery because I think about sort of as a clinician, when we have clients come into our office, there are some elements of relationship that they're bringing in that sort are a little scary at times, and you
Mhm.
really don't know how to navigate them. And you mentioned one, which is either a fair or betrayal recovery, rebuilding that trust system
Mhm.
within the relationship, which is included in this new book as well. And then, can you speak a little bit to domestic violence? That is also included in this book that is new. Can you tell me a little bit about that?
Hmm. Yeah. So John and his colleague, Robert Levinson,
Mm.
did lots of the original research, but then later on, John and a colleague, Neil Jacobson at
Mm.
University of Washington, right around year maybe 98, 99, something like that, had done a 9-year-long study on domestically violent couples. And they brought them into the lab. They had them go through the procedures of the lab and the assessment and
Mm.
so on. And we reinforce the idea that there's 2 types of domestic violence: characterological, which is very pure perpetrator victim. The victim can't
Mm.
do anything about the violence. The violence is severe, and the perpetrator takes no responsibility, versus what we call situational domestic violence. And our theory was that domestic violence situationally often results from people not being able to take a break when they get flooded. They don't know
Mm.
how to take a break. And secondly, they don't have the skills to actually process conflict in a calmer way.
Yeah.
So,
Or create intimacy.
or create intimacy. Thanks, honey. And
Mm.
so we actually took a program that we had developed early in the 2000s for couples in poverty, and we modified it to fit couples who have situational domestic violence. It was a
Mm.
curriculum where a group of couples met once a week for about 4 months or so, doing a different module every week. And by golly, we eliminated situational domestic violence. We reduced hostility significantly. We increased friendship. We increased intimacy.
And not
Wow.
only that, 18 months after the intervention, We brought cameras into the couple's home and assessed their physiology again during a conflict discussion, and the physiology stayed low 18 months after the treatment. So
Wow.
everything and behavior changed and perception changed, and even archival police records showed that there'd been no recurrence of the domestic violence. So Neil
Wow.
Jacobson and I did the basic research, but Julie and I really did the intervention research that shows that we can actually treat situational domestic violence, and we can discriminate characterological from situational.
Very important. And so that's a part of our assessment. That's a part of Gottman Connect. And it's a nice section in the new marriage clinic as well to really, we wanted to, we're getting old, guys, and we wanted to share with our clinicians, our favorite people who are going out there and really working their tails off to help couples. We wanted to share with them everything we know, basically.
Yeah.
About clinical work. And so that's what we tried to pack into the new marriage clinic.
I feel it. And you keep mentioning Gottman Connect. It's a tool that I have been using with my couples. I mean, ever since I didn't have to do the assessments myself with those papers and go to the printer, print them off, give them to my couples as a packet, score 'em myself. Now it's something that is done for me, which is absolutely amazing.
Right.
But I wanted to talk about something that we haven't talked about, because we mentioned that the assessments are a tool that is, when you meet with a couple, you're assessing where they're at before you're treating them. That is a tool that is on Gottman Connect. You also mentioned the modules, the 37 modules with the videos that couples can watch, but also as a clinician, I can watch it to remind myself, what is
Right.
this intervention again, right?
Mm-hmm.
But there's this other element that I wanted you to explain a little bit, because I'm still kind of wrapping my brain around it, how you're able to take elements of the Love Lab, old Love Lab, and bring it into now a virtual sort of Love Lab experience. Can you tell me a little bit about that?
Yeah, in the book we show this analysis of 2 minutes of a couple talking about the events of the day.
Mm,
And the first 45 seconds, there's a lot of positivity and interest in one another and curiosity about their day. It's very positive. And, we show that Gottman Connect can actually measure the trust metric, which we validated, and talk about how much trust was there in that positive interaction, 45 seconds. We can actually measure heart rate just directly from video on Gottman Connect. And we can see in that first 45 seconds, their heart rate was low. And we
yeah.
can measure, their emotional behavior. The machine is doing that through machine learning now. We've successfully patented an invention that allows the therapist to actually see the emotions of that couple. And that first 45 seconds, the sequence is interest in one another, followed by neutral, followed by more interest. Then everything changes because the wife says, "Oh, by the way, my parents, when they're visiting this weekend, I told them that they could stay in our room and we'll be on the couch." And he says, "You already told them?" He said, "Yeah." "Well, yeah, I don't sleep well on the couch. I want to be on my best behavior for your parents." And she says, "Oh, you've never been on my best behavior for 3 years. You've been putting them down, and you made my father cry on his birthday." "Oh, I was trying to be funny," he says. So now 75 seconds of the interaction, and the whole thing lasts just about 2 minutes. The trust metric plummets. His heart rate goes above 100 beats a minute, and and the sequence now go from anger to criticism to defensiveness to contempt, and we see the four horsemen.
So let me actually describe what's happening, what
Okay.
you're doing.
Yeah.
Okay. So after the questionnaires are taken and you get the results of those, for assessment. What you can also do is you can, if you might remember, our old assessment methods were being a fly on the wall as the therapist in the room and watching the couple have a conflict for 10 minutes, talking about a problem without your intervening, without your saying anything, doing anything. Okay, so now what we have is a couple, you can set up either a phone or your computer or whatever, and the couple is videotaped now having a conflict conversation for 10 minutes. And we'll also have a conversation about, the events of the day or the events of the week. And then after those, and all of this stuff is, there's very clear instructions on how to do this to the couple as well as to the clinician. So the videotape is amazing, as John said, because algorithms, we have these geniuses we're working with. The algorithms they've created now can determine without a pulse oximeter what the heart rates are of each partner, whether they're going up over 100 beats a minute or they're staying lower. And also the SPAF coding of the couple. I mean, this is coming, into the tool itself. The machine itself SPAF codes and reads, in other words, reads what emotions each person is putting out there and what the dynamics are and so on. So that's all getting done automatically through machine learning. And also what we'll do is we have each partner then privately look at the replay of each video. And at the bottom of the screen, it almost looks like a measuring stick, or a yardstick or something between, very negative and very positive. And when the individual is looking at the replay of each of their conversations, that individual partner moves the cursor and clicks on that little measuring stick at the bottom of the screen through each moment of the conversation, which to indicate how they felt during the conversation.
Right.
And then all that information is automatically fed into the algorithms. And so what you get out within seconds, I mean, it's just crazy, is a reading of the ratio of positive to negative, both in the first 3 minutes and cumulative. You get, oh God, there's so many things.
How stuck they are in negativity.
Right. Turning toward, you find out how much they're turning toward or not turning toward.
How much humor and affection there is and validation versus belligerence and hostility and contempt.
It's so
And the machine does as well as the best human observers, which is amazing.
Right.
I never thought that would be possible.
And
Yes. Oh, I was just thinking about that,
cool.
Going back to the original Love Lab and having researchers that have been trained in SPAF coding, observing, taking all of the data of their heart rate. I mean, this used to take, I don't even imagine how much time it took, but you just recruiting a couple to come and stay in the Love Lab. Now you're able to give everyone in the world the opportunity to have that access, right? That type of assessment done on their relationship just through technology.
Exactly.
Right.
And also, what is really cool is after they've completed those ratings and so on,
Mm.
All the data is combined with the questionnaires, and yeah, click a button. I really love this because I'm technologically impaired. I call
Yeah.
myself TI. So all I have to do is just click,
Yeah.
and out comes, if you want hard copy
Mm.
of, or, on the computer, a whole, like, God, I don't know, 10-page or something, evaluation of the
Mm-hmm.
couple, their strengths, their challenges, the
Mm-hmm.
other information
For
that
the
we just
therapist.
for the
Mm-hmm.
therapist. You've got one for the therapist. And if you want one for the couple, you
Yeah.
can get one for the couple that really describes not necessarily the individual difficulties that each partner may be having, which is included
Mm-hmm.
in the clinician's report.
Mm-hmm.
But, you're not going to want to have a
It's a
couple
more
see that.
appropriate version, right? For them to
Yeah,
digest and read about the relationship.
that's
Yeah.
right.
That
Yeah,
the therapist can hand the couple and go over with them to set treatment goals.
right.
Yeah.
So
It's
you're
wow.
clicking. That's it. So we
Yeah.
describe all of that in the new marriage clinic because
Right.
that's all
Mm-hmm.
stuff that we've developed in the last 5 years.
Yeah. Yeah, it's pretty amazing to think about. One, our profession as couples therapists, relationship experts is a relatively short profession. It hasn't been around for a very long time, but the interventions and the information that you have learned just in the last 25 years is kind of
Mhm.
astonishing. And so that's really what this is addressing, is what's new in the last 25 years.
That's
And
right.
the weaving in technology is such a significant piece of this as well. How
Right.
we can use technology to support couples as well.
Hmm.
Wow. Well, this has been, I mean, it's very exciting for me because it takes a load off of my shoulders, like you said, of being able to know exactly how to intervene with couples to make the most effective blueprints for them to work through their struggles, give them communication patterns. Is there anything else?
I
Hmm.
think what we've really tried to do is, um, first of all, give you something that's very, very readable, something where, can really be used as a reference book, you know.
Mm-hmm.
Um, so you've got a couple with a tremendous number of the four horsemen, that are galloping around. Okay. Well, you can go right into the index, look at that for the book, and see what you need to do
Hmm.
from the book. So it's almost like an instruction manual,
Yeah.
but hopefully less boring than an instruction manual. It's really a lot of fun to read. I mean, I really love this book. I spent long time. We both spent a long time writing
Well,
this
we
book.
haven't mentioned that
Yeah.
we also have included a couple's approach to addiction
Ah,
here.
right.
That was developed
Yes.
by Bob Navarro, one of our great
Mhm.
creative therapists. Uh, and addiction is something that we see a lot. We see those comorbidities quite often
Yeah.
with
Yeah.
couples. And also
Hmm.
Julie's excellent work on trauma that she's been
Mm.
doing, for the past 45 years, a way to approach trauma
Yeah.
that underlies a lot of things. For example, there's always PTSD when there's an affair for the
Yeah.
betrayed partner.
Yeah. Yeah. And underlying all of that, which we haven't even really talked about, is physiology
Right.
and
Oh.
how that plays into each and every session.
Mhm.
And, I was thinking about it because I was reading this book, and I do have to say it was a lot of fun. As I was going through each chapter, I have couples that pop into my mind, and I'm jotting notes down of like, be sure to do this intervention with this couple because I forgot about that one, and that's a really important one. But I do want to talk about, why is it so important that clinicians pay attention to physiology? And not only that, that we teach our couples to pay attention to physiology when they're home. Because you were talking about the domestic violent couples and how their physiology
Right.
after 18 months had changed. Let's talk
Right.
just briefly about physiology.
Mhm.
Yeah. a lot of times we think, couples in front of us, they're so mean to each other. They have this escalating conflict, it goes out of control. We don't know what to do. We can't even get them to shut up. We can't stop already. What's going on? This is love that's gone awry, that's out of control. Well, a lot of that is because people are in fight or flight. They're secreting cortisol and adrenaline, and their immune systems are suffering even during the conflict when the four horsemen are there. So to know something about physiology in the moment, actually having a pulse oximeter, or in our case, actually getting the heart rate from the video, which is our new patented invention. We can know instantly that they're flooded, and that's why it's getting escalated. And then we can help them to self-soothe, take a break, and not think about the fight, and really become calm. And then all of a sudden, when they're calm, it's like a different relationship. It's like they've had a brain transplant.
Huh.
Yeah. The only other thing I would add to that is that there's no way that therapists, I mean, this has been studied, there's no way that therapists, just by looking at the couple on the couch, can determine what their heart rate is doing.
Right.
There's no way. And fight or flight, or flooding as we call it, makes such a huge difference because, people can't think straight, they can't listen well. All they hear is attack. It's like they're facing a saber-toothed tiger, right? And so their reactions, are just off the charts.
Counterattack.
That's where you get all the meanness or all the insults or the contempt or whatever. But looking at that couple sitting on the couch, you would never know that their heart rates are that high. And that, as Dan Siegel likes to say, they flip their lids, right? And
Adios, prefrontal cortex. See you later.
that's exactly. They've only got half a brain they're operating with, right? So you got to know that stuff because it's not going to help you to try and teach them how to do, I don't know, a dream within conflict in that moment. They've got to self-soothe. They've got to take a break. And we have very specific ways of them taking a break. So, and all that stuff is described in the book too.
Yeah, it is. It was a good reminder going through and reading more about the physiology. I see Kevin's on here. Hi, Kevin.
Hello, everyone. Laura, John, Julie, thank you so much for all that insight about the book. We have a couple of questions in the Q&A, so I thought I just wanted to interject to make sure we can get some responses from John and Julie.
Thank you, Kevin.
Thank you. Laura Hensky asks, I am a researcher, a psychology student, and a Gottman fangirl. I refer to them as my psychology parents.
Grandparents at this stage.
My question is, what interventions best assist with solving challenges caused by in-laws, friends, and other third parties?
Okay. Well, first of all, I'm not quite sure about the question in the sense that is the asker of the question saying the problems that occur in the relationship about in-laws or friends or whatever, or are they talking about an actual relationship with the in-law themselves or the friend or whoever? But Kevin, do you have a thought about that?
I think what she's asking is what interventions for the therapist might be best in solving those challenges for the clients, and those clients being in-laws, friends, and other third parties.
Yeah.
Okay. All right. So, so what the therapist wants to do here, it's a perfect opportunity to look at perpetual problems and look at the blueprint for how to deal with perpetual gridlock problems, whether they're with in-laws, whether they're with friendship, whatever. And so the typical interventions we're going to use is, first of all, one person uses the Gottman-Rappaport intervention, which creates a softened startup rather than a harsh startup to bring up the issue. Because as we know, the first 3 minutes of a conflict conversation actually predicts not only how the rest of the conversation will go with 96% accuracy, but how the rest of the relationship will go 6 years down the road with over 90% accuracy. So we use the Gottman-Rappaport to bring up each person's position on whatever this issue is. And so it's a little bit like active listening, but it's a corrective of that because it also helps direct how the speaker should bring up their feelings and their needs, not only how the listener should reflect back and so on. Secondly, dream within conflict. So the dream within conflict is really important here. To understand each person's position regarding these external relationships. And then 3, compromise. And we have a special method for compromise also. So those 3 would be the big ones to use when dealing with problems like our participant just asked.
Terrific, terrific. Thank you, Julie. Thea Bailey asks, after the conflict conversation the couple undertake as part of the assessment, if the couple are doing it themselves at home, what advice is good to pass on to couples, as some of mine are reluctant to do the videos as they are already not talking much or considering divorce or in the eye of the storm and do not want to rock the boat with a conflict discussion?
Okay, so it sounds like this is a couple who is avoidant, conflict avoider. You know, we have 3 different styles for couples. This is part of our research too, in terms of how couples handle conflict. So these are conflict avoiders who don't want to talk about conflict at all, let alone be videotaped doing it, right? Okay. So what you can ask the couple to do during the assessment, if they're afraid to talk about a conflict, is talk perhaps about an event in the future that they're planning and just have a conversation about that. How
something that's stressful that they're looking forward to in the future.
Looking forward to.
It could be a road trip, a vacation to
with
an in-law.
17 children in the car.
Right.
Is it important to have the stressful piece be a part of
Yes.
that?
Yeah.
Okay.
Because conflict avoiders really are aware of stressful situations. And often, you know, what they're going to do is not problem solve or try to persuade their partner, but really explore each person's worries and fears about an issue. And so, yeah, it should be a stressful situation that they're talking about. And you can get a lot of information for them just talking about the events of their day or the events of the week. That can tell you a lot.
Right. Beth Cohen asks, what does the book include that's not already in the level 1 and level 2 training manuals?
Oh, gosh. Well, much more detail about treating affairs, much more detail about treating domestic violence, much more detail about treating addiction, much more about the technology that can accompany the book, how to get that assessment process down as a clinician without fear and insecurity.
We are modifying the treatment manuals to work better and more smoothly with Gottman Connect. But the book is something that you read on your own. You're not going to with an in-person training. You're not going to be reading. You're going to be listening to a presentation and actively discussing or role playing. But when you're at home, you know, you can read what the research really says and get much more information about particular problems. Like, for example, we have a whole chapter on the couple that is really not talking to each other at all.
Mm. Is
This
this the devitalized couple?
the
Is that what you're talking
devitalized
about?
couple.
Yeah.
Yeah. And, the devitalized couple is one that, has been identified, even going back to the 1930s, people identified these devitalized couples, the ones that you see in restaurants that aren't talking to each other throughout the whole meal, and it's not that they have huge amounts of conflict. They generally don't want to talk about anything, and they don't know how to have conversations. There's not much joy, not much playfulness, adventure, great sex. It's gone from those relationships.
Great. Andrea Kelly asks, have you used any of these interventions in couples counseling groups? Any tips or special considerations when working with groups?
Yes, tons and tons. So the curriculum that we created for couples in poverty was a couples group that had, each meeting of the couples group, and there would be maybe 6 to 8 couples in a group. Actually had a lot of conversation first between the couples in the group about a particular theme of that week, but then also had exercises to do during each group meeting that taught each couple individually, how to do a particular exercise or how to do the intervention work that you would ordinarily be doing in therapy. So, yes, this stuff is extremely useful for couples groups.
Great. An anonymous attendee, thank you for updating your book. What advice would you have for reading, using it as a resource for clinicians who do not primarily use the Gottman method with their clients?
I don't know. I mean, that's a hard question.
Well, let me.
Can I?
Yeah, go ahead.
finish? So, what you can do is, first of all, you're going to get an understanding of the dynamics that you're seeing in a couple. So, if you're not using the Gottman method, if you're not doing assessment, there's all kinds of thoughts about that in this book because assessment is so absolutely crucial before you begin your intervention. So if you're not doing Gottman method, maybe you'd consider at least doing assessment to see what the strengths and challenges are, what the comorbidities are. That's a big part of Gottman method. But also, these interventions, it's I don't know if I should say this, but for people who are religious, you may not take every single word of advice in the Bible or the Torah or the Quran or your religious scripture, but you're going to take what applies to you, what makes sense to you. And we're not looking for a fan club. I mean, thank you very much. It's really nice. But, we really firmly believe that the therapist, him or her or their self, is the best instrument of therapy. So what works for you, absorb. What doesn't work for you, ignore. It's up to you.
Yeah, I'm sorry I interrupted you, but what I wanted to say was that read the book and pick and choose and see what works and doesn't work with your clients.
Yeah.
Terrific. We have time for one more question, and it is rather holistic in its nature, I think. Curious what your top 3 takeaways are about great relationships. The bigger question would be, Gottman's life lessons year to date, advice to younger selves, advice to younger selves, or curious grandchildren. So the first part, what are the top 3 takeaways about great relationships, and then what advice you would possibly give to your younger self or curious grandchildren?
That's so, what a lovely question. Okay. Top takeaways. Okay. Number 1, in relationships, be kind, of course. Try to be kind. Try to be kind. Try to realize that your partner is not a clone of you. Your partner is different than you in all kinds of ways. And it's very, very important to understand where those differences come from, what those differences are, what your partner's enduring vulnerabilities are, and to, remember that about your partner, that they're unique in themselves. And trying to understand means putting yourself in their shoes. That's what you want to try and do. Put yourself in their shoes. Secondly, this is a hard one, Kevin, but have gratitude. And the reason I say that is people often only look for what's wrong in the relationship. They don't look for what's right. So have your grandkids or whoever focus also on what your partner is doing right, not just what's wrong. And the third big takeaway would be, when you're bringing up an issue, don't describe your partner, which usually ends up in criticism. Describe yourself, what you feel about what situation and what your own needs are, and make those needs positive needs, meaning what you want your partner to do to shine for you, not what you don't want or resent. How about you?
So I think one of the critical things is that when your partner's upset, it seems like in a great relationship, the masters of relationship, as we call them, are really curious about why the partner's upset, rather than pushing it away and shutting it down. They ask questions. They want to know. And so I have a really big invention. It's called a notebook that fits in my back pocket. And whenever Julie's upset about anything, I whip out my notebook and I get my pen and I say, "Talk to me, baby. I'm listening. I'm going to write down what you say." And the more defensive I feel, the more I slow her down so I can write down every word. And while I'm writing, my first thought is, God, why does she have to be so negative? Why can't she see all the great things I'm doing? And then I write a little more and I go, oh, that's a good point. Yeah, interesting. I never thought of that. Okay. I need to know more about that. I keep writing, calms me down, and I may ask a question like, can you say more about that? Because I don't understand that. And she will. And then I'm writing, and guess what? I'm waiting before I even say anything about what I think. I'm trying to understand what she thinks. So the notebook is a great invention for all people to have, either in their purse or back pocket.
And if you have a really talkative partner, like I can be once in a while, you might consider expanding to a nice, large, legal size yellow pad.
Right.
Julie's like, John, I need you to upgrade. I need something bigger for you to write on because I have a lot to say about my pain right now. Yeah.
That's right.
That's right, Laura.
Fill a whole notebook.
Yeah.
Yep. Here it is. My invention.
That's wonderful. I think in an ideal way for us to wrap up the conversation, I want to thank Dr. John Gottman, Dr. Julie Gottman, Laura, for a wonderful job at moderating. We are proud publishers of the Gottmans. So thank you all for all these insights about the New Marriage Clinic. A final reminder to our attendees, discount links, 20% off and free shipping are there. There's also, John and Julie created a guide to the marriage clinic, which is also here. You can see the link. This conversation will be archived on the Norton Mental Health YouTube page, on our social media channels. Anyone that's attending here, we're going to be sending you this archived conversation, so you'll have those links again. And again, I want to thank attended, and especially John, Julie, Laura, thank you so much. It's been really wonderful.
And Kevin, we're going to have an instructor manual with test items
professors.
and
Thank you.
discussion questions for professors teaching with this book.
Thank you for that reminder. Yes, thank you, John. The instructor's manual.
Thank you, Laura. Thank you, Kevin. Thank you, Joy.
Thank you. Take care, everyone.
Thanks, everybody. Thank you.
Bye.
Bye.
Bye-bye.